You need to have your staff engaged for a successful switch to a patient-centered medical home. Large practices have multiple physicians and mid-level providers, and usually a team of assistants that work closely with each of them. From this team, you can designate a patient-centered medical home champion and empower that person to help you make changes in your practice to create a medical home. What I did was look at the strengths of my own staff. I have a front office person who is very meticulous and good at gathering data. She does mostly the registration and collects all this information up front, whether it's patient's email address, their local pharmacy that they prefer, phone numbers. Once that's placed into our electronic medical record system, it's there for everyone to see. My medical assistant in the back does more of the clinical evaluations and assesses immunization status, health maintenance screening, and things like that. One way of determining and assigning these roles is to have an all-staff kickoff meeting. In this meeting, you can share your ideas of what a patient-centered medical home would be like and what the staff thinks a patient-centered medical home would be like for their practice. Talk about things that you're already doing that meet the criteria for a medical home and things that you would need to change. If every member is involved in the transition, they are more likely to be invested in the changes in the practice. Most importantly, all physicians need to be on board and aligned with these changes. The staff will take cues from them, so it's important that if the physicians have any questions or concerns, these be addressed early on. You would like the physicians to be active participants and partners in this transition. It's difficult at first to get all the changes underway, but once it's done, it's more habit and routine, and the workflow does flow more easily and efficiently. I think one of the things to remember is that this is really for better patient care, and having that as the forefront, and if the staff realizes that as well, it makes all of the hard work understandable. But most of this you're already doing. It's just trying to incorporate it into your workflow to make it be done more efficiently.